Hello, I'm Dr. Ed Chaperone. I'm Associate Professor of Medical Microbiology and Immunology in the College of Medicine, and I'll be your instructor this fall in the Microbiology 141 course for students in the College of Nursing. I've been teaching this course for quite a long time now, and I guess I've learned a little bit over the years. Students seem to like the course and they find it to be profitable. We cover a lot of things. We start out and we review a little bit of the biology and genetics and chemistry that you had in your first year just to refresh your memories. And then we start right off into an overview of infection control, particularly with disinfection, sterilization, learning how to wash your hands, and then we move from there on into an overview of the major antimicrobial agents and talking about the ones that you may be familiar to many of these, and we're developing new ones all the time because of the problems of emerging resistance. And so we will talk about that and talk about the directions in the future in research in antibiotics. Moving on, we'll cover the area of immunology, and we start off again with some basic concepts and things that is necessary before we can move on to the discussion of things like allergies and autoimmune diseases, and talk about vaccines, talk about immune deficiency diseases, and transplantation immunology, and even a little time spent on the area of what we call cancer immunology. Then we move on to my favorite part of the course, which I call the bug parade. And if you've talked to students from either last year, they will tell you to watch out for the bug parade. We cover all the bacteriology in this section in particular, and we'll cover them. We'll talk about them and what they look like and how they're transmitted, and how people can resist and can protect themselves against these infections. We'll talk about respiratory infections, diarrheal diseases, talk about sexually transmitted diseases, and diseases that are transmitted by insect vectors. And so we'll cover pretty much the gamut. And after that, of course, we'll cover the virology in pretty much the same way. You talk about the respiratory viruses and the viruses that cause disease, like norovirus. And then we'll spend some time on the wonderful world of worms, which I'm sure you'll really appreciate since we lecture at noon hour. And then we have a couple of visiting lectures by the infectious disease control nurse from St. Joe's Hospital, and she's going to talk about epidemiology. And then she'll talk in the last lecture in the course about problems of infections in healthcare facilities. And we'll talk particularly about infections in the very young, in the very old, and patients that really have other underlying conditions making them more susceptible to infection. So we cover a lot of things, and it's all very important to you as nurses and in your future careers. We're going to try to make it interesting for you, try to make it a little bit entertaining at times. They say I'm a sketch, and we'll try not to overburden you, and we'll have, of course, the usual examinations to find out how well you're doing. If you study, you'll do well. We use the Bluecast again this year so that you'll be able to review the lectures online. We give you death by PowerPoint, of course, and so anyway, we're looking forward to seeing you this fall. And anyway, we thank you now. I thank you very much for taking a few minutes to watch this short video.